the same. I think earlier in the week we had as many as 20-some hospitalized for respiratory illness overall, not just influenza, but it is prominent.
Yeah, I believe today we had 8 influenza positive and 8, and it was 8 and 9, 8 or 9 COVID and 8 or 9 influenza.
Any questions?
I guess, can you speak to vaccine hesitancy related to the flu? Because it actually went up a little bit at Union, I think, the hesitancy there. What are you guys seeing at the county level?
I think there's a vaccine hesitancy by most children's vaccines for adult that seems to be causing kind of big one.
And getting worse. Yeah.
You know, it's really interesting because we've been doing pop-up clinics, and we have the State Board of Health come and do vaccines, and we've had great utilization of that amongst the homeless population. So yeah, it's just kind of interesting how he's choosing to and he's not. Yeah. All right. Anything else for Dr. Barkin? All right, administrator report for Joni? Questions or concerns for Joni? What happens at Christmas parties stays at Christmas parties. All right, we have some new business. Looks like we need to elect officers. So we need to elect both president and VP. Okay. Do we have any nominations for president?
Yeah, I'd like to nominate Dr. Amber Caddick for president.
All those in favor?
Aye.
Aye.
Opposed? Thank you. Thank you very much. All right, how about for vice president? Any nominations for VP?
I'd like to nominate Mark Kyleman for VP.
All right, all those in favor?
Aye.
Opposed? Okay, great. Look forward to working with you, Mark. All right, old business. It looks like we have our date set for this year. I was grateful that this time it didn't fall on my birthday in January, so thank you very much. All right, and then Oh, yeah, go ahead. Nice.
Are we using YouTube as a platform for that? Okay.
We archive it for 70 years. And they're always interesting, sometimes if you can't make it to like a county council or commissioners meeting, I like listening to them if I'm out doing something.
Mhm.
And it just keeps us in tune with what's going on in the county and other departments.
It's a good platform to use, for sure.
Great. All right, program updates. Shelby? For health education?
Joni, can you do a favor and lift your microphone a little bit from the phone? I'm wondering if we're not getting feedback from there. It might be Mars. We'll have IT look into that tomorrow. So on the minutes, you can see some of the different subjects that have been focused on around the building, but also within the community. So the bulletin boards that are around in the annex itself, the monthly employee newsletters that go out to about 650 to 700 employees, how many we have given the season, and also all of the installments. So the little 8.5 by 11 infographic sheets that are in all of the restrooms. We also received take-home radon tests from Indiana Department of Health last quarter, so that way those can be given out to the community for the upcoming Radon Action Week, which is later in the month of January. We have 28 doses of Narcan right now, so if you know of anyone in the community that would need some, we have plenty available, and I can always order more when needed. The past quarter, I got a little creative, and not intentional at all, but with one of the installments, I decided to do a kind of twist on a local poem that's really known well, you know, The Silent Night, or the night before Christmas. And I just happened to read that at one of the fetal infant mortality review meetings that I attend, and from there it hit the wall. We went running with it as a team, and we got it across Union Radio. We got it in the newspaper. It went out to a lot of different health departments across the state, and I've heard that it even went to a few people at the state level too. It should be attached on the page 3 of my report if you'd like to read it at your convenience. So hopefully next year we'll have a much bigger push with that poem. Congratulations to the Vigo County Highway Department. They were actually the first department to get all of their employees certified within first aid, CPR, and AED. So that was very busy trying to get all 31 of their employees certified, but we did it. And lastly, myself as well as Amanda Shook-Baker, we are going to be taking over the ServSafe classes for the community. So ourselves, we got certified in ServSafe instructor and manager, and we're going through all of the materials and downloading all of the equipment needed to facilitate the lesson, the course, and the test itself. So fingers crossed we can get that implemented around late spring. Any questions? There is a new immersive mobile learning unit coming to Vigo County Health Department, and it is the Safe Sleep Trailer. And this approach came about a way of, if we're teaching the same material to the same audience, the same time period, how much information are they actually retaining? So I took that into heart. Let's meet people where they truly are at. Created this mobile unit that we can also dual purpose for different supplies when we need to. But the inside of it is going to be set up similar to an infant's nursery. So it's going to have a crib, it's going to have a pack and play, it's going to have a car seat, it's going to have some of the things that you probably shouldn't put baby to sleep in, but we see it a lot around the community. And so that way when people come onto the trailer, we can ask them, how do you put baby to sleep? And the crib is gonna be set up with blankets and stuffed animals because the idea is I want to see them pull those objects out. And if they do not have a pack and play, hopefully I will have in some built-in storage within the trailer itself, so I'll have pack and plays there as well as our sleep sacks. So that way it's kind of dual purpose. And there's nothing like this out there yet around the state. So I have a feeling Vigo County Health Department is going to be known pretty well after this as we travel around Indiana with this mobile immersive learning. We'll take it pretty much anywhere. A big one will probably be Union's baby shower, the community baby shower. I know the library has kind of like a health fair, summer fair thing that they do in late summer. There's a few different fairs that the community puts on. But really anywhere, any churches, support groups, anything like that, that they would like us there, we'll meet them there.
All right, can you hear me now? The button's sticking. Anyway, I love the concept. And so there's something really similar done in the clinical world that the Rural Health Innovation Collaborative uses. And so I would recommend reaching out to them. They use this for nurse training, and they call it a room of horrors. And so they set up a patient room with all these different things that are wrong in the room, as far as like Foley catheters and different things. And so they may be a good group to reach out to when you look at setting this up and making it interactive. They've been doing it for a long time, and it works really well for training nurses, nurses' aides, and anybody that comes through the hospital. They find that they walk into the room after they've taken the training. They walk into the room and they know that's wrong, that's wrong, that's wrong, that's wrong, and they can pick it out that way. And so I love this opportunity for people that are visual learners to be able to pick up on this instead of just giving somebody a flyer or something. So I applaud you for that. It sounds like a really good program.
Thank you. It was inspired by Mental Health America's Hidden in Plain Sight
Yeah.
trailer.
That one is great
Mhm.
and terrifying as a parent. Yeah. Great. Thank you, Shelby.
Thank you.
All right. Vector control, Mike.
Good afternoon. As everybody knows, this is my time off. But we've been doing maintenance on our vehicles, and it's nice to have a nice fleet. I got to pat Joni on the back. We've got a nice fleet of vehicles, and it makes it so much easier to maintain them. I mean, we didn't even use all of our money from our budget repair this year. Makes my job a lot easier. We did send in 3 bats and 1 raccoon for rabies testing. 1 bat did come back positive for rabies, and the homeowner had to receive the shots, her and her son both. Other than that, we picked up 71 deer. I knew you were interested in that, Mark. And that wasn't what the hunters took. That was what went out there and got hit by the traffic. But other than that, we've been staying busy. Got a new bathroom installed. I got to mention that, Joni. I mean, Amber, you've been up to our
Yeah.
facility. We got a new bathroom installed. It's
exciting.
fantastic.
Oh. Yeah.
It's nice.
Nice.
Any questions?
Did the rat house finally get cleared up?
Did the what?
The rat house, did that finally get cleared up?
Yes, yes, it did. Yes. Both of them that we had going on at
Oh,
the same
both.
time. Yeah, so they got, both of them got taken care of.
Nice.
All right.
Yeah. Thank you, Mike. All right, nursing. Carolyn?
So, good evening, or afternoon, I guess. With the communicable disease investigations, the largest number you can see of cases were animal bites at 68, and the second runner-up was hepatitis C chronic at 13. Total number of TB skin tests given were 205. with a total number of vaccines given of 940, and we saw 1,138 client visits for fourth quarter. Per our insurance billing specialist, we continue to successfully receive reimbursement for child and adult vaccines, as well as for lead testing. And we continue with administration of all school-required immunizations. We completed it seems like we completed more than this, but for the month of October, 4 employee flu vaccine clinics. Kayla, our school health liaison, attended several trainings and meetings with other school health liaisons for team building and preparation for the new 2025 school year. And we would also like to welcome our new RN, Deborah Sweeting Cowan, sorry. She has come to our team, and we are very lucky to have her since November 20th.
So the animal bites, were they mainly dog bites, or do we know what type of animals?
More dog bites,
Okay.
but
Okay.
one was a mongoose. Wild, yeah.
You can't make this stuff.
No, you can't make it up.
Okay.
I'm not sure why you'd want to have a pet mongoose, but,
I mean, are they mainly pets? Are they wild animals? I just was curious if we need to have
oh,
some
they're mainly pets.
education. Okay.
Yeah,
Oh.
yeah. I don't. I can't. I was here, I administered it, but I do not know that, sorry. It's, you mean? Oh, I see what, okay, thank you, Joe. Yeah, yes. Anything else? Okay, I hope we answered.
It's not a hard one. So the Kayla, the school representative,
Yes.
does she go to specific schools, or how is she dispatched?
She coordinates with all the Vigo County schools.
Okay.
And she actually, and Kayla, if I'm missing something, tell me. She actually, with some of her training, she and met with Highland Academy as far as setting up dental, mobile dental
Mobile
clinic.
dentistry, okay.
Dentistry, and she her school calendar is set with the chief school nurse, Eleni,
Okay,
and she coordinates on a daily basis with the other school nurses as
Okay.
far as which school she is going to go to.
yep.
Do you have anything
Yeah.
I don't know your typical weekend school.
So it's, starting from the ground up. And I'm trying to do as much as I can. It's not been here very long, just since August. So I've met with all Vigo schools, I think there's like 25, 26 maybe, in the month of October. So I think the last 3 weeks of October, I went to every single school. I met with all the health aides, some of the principals, not all of them. I went to the, I don't know what it's called, I think it's also called the annex. It's the school, Vigo County School, where the nurses are located. I went there, talked with all of them, and then Teams meetings. I've been doing like a lot of online training, so like Catch My Breath, so I can go into each school and teach, you know, I can do the train the trainer since I did the train the training part.
Yeah.
So I can go in and teach that in the schools.
Do you see, so when you've been going to these schools, do you see that there is definitely a need for education within the nursing units and the medical units inside of these? Do you see an opportunity to be able to target different things that could really help these people, give them tools?
Yeah, yeah.
Okay.
They're all interested in the Catch My Breath. Most of the people that I talked to in like the aides and stuff, they all already had the Stop the Bleed.
Mm-hmm.
So I did the online course, but I didn't do the in-person course yet for that. But they all said that it's like a requirement for them to do.
Mm-hmm.
So it's like a training, I'm assuming maybe yearly that they do. I got into my first private school, which is Highland Academy, like she had mentioned. I'm going the 24th. We have a mobile dentist coming. So that'd be interesting to see how that works.
Yeah.
So we have several kids signed up and ready to go.
Great.
So, and they're also interested in the Catch My Breath. They're wanting an AED put in their school. They do not currently have one at all.
Mm-hmm.
They're wanting to have some fire safety, which they do a monthly fire drill, but they're wanting what like the Vigo schools have. Like they want someone to come in and have like those plastic hats and
Yeah.
Mr. and Mrs. Flame, and so
Yeah.
you know they want to be involved in all of that.
Yeah.
So
Great. Well, thank you for the work you do.
yeah,
And I'm sure there's a lot of it out there.
yeah. Thank you.
Any other questions for Nursing? Okay, thank you. All right, environmental, Amanda?
Hi, guys.
Hey.
So last quarter, we wrapped up all of our food inspections, our second inspection for the year. They are all inspected twice a year, sometimes more if needed. So that's the food side. On-site sewage, they continued to be busy with reviewing ILPs. They did like 7 dye tests, which is kind of unusual. We don't usually do a dye test. I'm losing my voice. And I think we found the source on several of those of where the outletting sewage was coming from. That's kind of an intense process. Let's look on into, right now, we just got done, we're still wrapping up, issuing all of our permits for all of our restaurants. So we have over 500 that we have to issue, and we're wrapping that up. Hopefully we'll be done by the beginning of next week. Something else that I wanted to mention is that I sent you all a copy of the on-site sewage ordinance that we had written. After a lot of talks with the staff, I think we're gonna hold off on the ordinance right now. Only 17 in the state has been passed by the TRP, which is the Technical Review Panel. What the state has done is they've taken the ordinance, they gave us a sample ordinance to use. And what they're doing is they're standardizing all of the counties. So they're wanting us all to pretty much use the same ordinance. And the ordinance pretty much reflects, I don't want to say pretty much, it reflects the on-site sewage rule, code, state rule that is put out. So we felt that writing an ordinance at this time, even though we spent a lot of time on it, is just not necessary. And we look for there to be more changes to come, which would be something else that we would have to take in front of you guys, then to the commissioners, then to TRP, and hope that TRP passes it, because if they don't, then we're back at square one. So that's where we're at with that ordinance. We do have our fee schedule that you guys passed and the commissioners passed. So we are good as far as our fees go across the board with all of our programs. Any questions?
So am I interpreting correctly, we're following the state ordinance?
Absolutely.
So no need to duplicate by having our own applicable thing?
Absolutely.
Okay.
Yeah.
So the minimum is being met.
Yeah. With all of our other programs, we can be more strict than the state rule.
Sure.
With this, they've signed into code that we cannot be more strict. So, for example, our old ordinance stated that we had to do 1,000 square foot bed with 1,000 tank. Now the new code sizes it with a 750 gallon tank, and then the square foot of the bed can be 450 square feet. So they've really shrunk the system up. So what we're doing on our recommendation page, when they send out for what type of system can be installed, I'm having the septic people put in their state minimum and then what our recommendation is. Because we would still like to see the 1,000 minimum, because we know that down the road there won't be failures on the system if they do everything that they're supposed to do and do it correctly. Where now, if they do the minimum, we don't know how long that system's gonna last with the minimum state requirements. So that's, we're covering with our recommendation, we're doing the state minimum, then recommending what we would like to see put in. And then it's up to the homeowner on what they choose to do.
Have other counties tried to implement their own and it been vetoed? Gotcha. Okay.
Yeah, like I said, there's 92 counties and 17's been passed with their ordinance. And honestly, I submitted the ordinance to, and I copied the state's sample ordinance verbatim. And she returned it to me 8 times, completely butchered. So at that point, I was like, So that's where we're at.
Thank you for all your hard work on it.
Yeah.
Sorry.
No, it's okay.
Didn't go anywhere.
It's okay. We have something. So if it comes about, but we just don't feel like we need the ordinance right now.
Yeah.
So, all right. Any other questions? No.
All right, social services, Molly? Oh, wait, did I skip? Loretta, you're next.
Good evening. So I wanted to start off by introducing our intake coordinator we just hired. Tiffany, go and stand up. This is Tiffany Fag. She's going to be our intake coordinator. She's going to be focused on initial screenings, identifying needs that need met, so we can go ahead and get those individuals assigned to a peer coach and then make the connection right away. So if they get released before they come to our classes, then we have them on our radar. This is going to change the game for what we're doing. Because, we're trying to keep them out of there, and teaching the classes is a huge help, but we need to spend some more time like connecting with them as they leave the jail, and she's going to be our connection for that. I added in the graph too, so you can see all 4 quarters last year up to now. The difference in the numbers, it's pretty much the same. It looks like in the spring we had more participants in the program. I think that sometimes once the weather gets warm, people tend to make bad decisions and get put in jail. That's my assumption for that number being higher in the spring. The number of individuals we're currently peer coaching is 41, and that is just in the jail. The number of individuals that we've gotten enrolled in insurance as a total is 48. Our graduates up to this point are 128. The number of total participants in the MRT program right now in the jail is 113. We have 10 that have been released who we are still working with. And I wanted to add too, because I talk about all the good things all the time. We do have 2 that have been released who have relapsed, but we're still working with them to get them back on track. It's part of it, but they've been honest with us, and I think that that's a great sign for what we're doing. And the number of, we have the change program, which last time we met, I kind of explained that to you guys. And we have 77 participants in that program currently.
That's great. Well, and substance dependence is a relapsing remitting condition. So
Yes.
relapse, unfortunately, is part of the way it rolls. So I just that's pretty great
Well, that's what I was gonna
success.
say. I mean, I
Yeah.
think two's phenomenal.
Yeah.
So I think it's great work.
Yeah, absolutely.
Do you have any questions for me?
I was gonna ask a question. How is the relationship with the jail itself? Because you are really increasing services and really trying to do some good work, but I know you have to probably work pretty closely with the
Yeah,
staff
they've-
at the jail, the supervisors. Can you talk to us a little bit about integration with them? Especially
Yeah,
adding
it's
the
actually
intake coordinator?
been really good. The communication's been open. Anytime anything happens, we have a question, all we have to do is go to the commander or the matron, who's Casey Lee and Charlie Funk. They've been really good at resolving any issues that we've had, and we're currently working in collaboration, working out some logistics to get Tiffany in there. But they're working with us on it and moving forward with everything. The staff at the jail has been phenomenal to us. Wouldn't you guys agree? I mean, they've welcomed us with open arms, and literally, they know when we're coming. What block do you need? They get them. You know what I mean? I was nervous at first, when something's new like that, and they're custody officers, and so, they have a job to do, and bringing more work to them. I was worried about doing that, but they've been great. They've been phenomenal, so.
So am I understanding this correctly? We're saying 2 out of the 128 graduates have relapsed?
Well, some of those graduates are still in jail.
Okay.
So 2 of them that had gotten released,
Okay.
and we were working closely with, one
So
of them
2
I
of the
just found out
10.
yesterday. Mhm.
2 of the 10 have.
Yes, yes, correct.
What is the recidivism rate for those that didn't go through coaching? Do we know?
I don't know. I know, I don't know that number.
Okay,
I'm
okay.
sorry.
No, that's okay. I was just curious.
Okay.
I just think it would help demonstrate, I mean, we all know the good work you're doing, and you don't need to sell it to us.
Yeah, so I've
But
talked
as we
to,
promote and try and grow.
I talked to Sheriff Fell about, looking at the numbers for 2023, 2024, and then obviously 2025 at the end of this year to see, how it's gonna compare. We just won't know, you know what I mean, until then, and I feel like we did great last year getting in there and starting the classes, and this year adding Tiffany, to identify those needs right out of the gate is gonna be, it's gonna be phenomenal. I'm super excited about it and ready to get that going.
I know I always ask the question, what's next? What do you see coming up if, that's a lot. You said you have 113 right now in the
Yes.
program, and how many of you are all trying to manage 113?
Me, Larry, and Shauna.
Okay, and you're doing the after piece, following up
Yes.
with pieces? Okay.
Yes.
So what do you anticipate this year or next year?
I anticipate, so what the process is gonna look like for Tiffany, and I hope this answers your question. So she's gonna identify their needs, she's gonna report to me, I'm gonna assign a peer coach, me included, so we're all 3 gonna tackle it. I think that, identifying their needs early on, and so we're gonna work with the jail as well, and so we'll know when they're possibly getting released, and so meeting with them there before they leave, knowing where they're going, that they have a safe place to go, that they have the insurance, that they have, you understand what I mean? Like,
Yeah.
that piece is what I'm super excited about, and I really feel like, it's going to amplify our program as far as being more successful by adding that piece. And you guys had asked me a question last time I was here, and I think you might have asked one of the guys who spoke, but it was, what do you need when you get released or in the first year to help you succeed? And I gave my guys on Monday a homework assignment in one of my classes, and I teach them MRT, and then today we do the change program. And these were the responses that I got from them. Clothing, sometimes we leave here without anything, just what we got arrested in was what one of the guys said. Food, housing, sometimes it's really hard to get a deposit and a first month's rent and a utility deposit, and that's why we end up homeless again, because we can't get that. Transportation, which we have the bus system now for in town, but not rural, can I say that, please? Rural communities. The next one was helping them get an ID, social security card, and birth certificate, which we're already kind of doing that, and we have for some of our guys and women who have been released, helping them get employment. They get really discouraged when they fill out job applications, and a lot of places won't hire felons. And so we have a pretty broad list of entities in Vigo County that will hire felons, and so we will be able to get with them to find them some employment. And then the last one was access to health care.
Yeah, that was one of my questions, because I was wondering, and so this list is exactly what we see in our community when we're looking at social determinants of health. I mean, these are the exact same things, but they're battling all of them at once.
Yes.
Which is so much more difficult. So when it comes to access to care, are you using certain clinics? Are you using FQHCs? Are you using their other established providers? I'm just wondering if there are ways that, we could help, or somehow the community we could help so that they could get care, because a lot of them they're going to be on medications. Those will have to be refilled in a certain amount of time. They probably have 30 days of those, and so if those don't get refilled, that becomes a big.
Yes.
What are ways that the community could help with that?
So I have a list of community partners who have agreed to help, and Ken Massey, you guys know him, he has agreed to help and has already helped a few people, and Valley Professionals, and I have a list in my office of people that I've spoke to. Yes. There's the place on Locust. Is that? Okay, yeah. So sometimes they can't get in right away either, and so when I spoke to Ken, he said, all you have to do is call me. He goes to Teen Challenge, he already does that, and so he offered to volunteer his time with us as well for individuals who, say they get out of jail and they already have their 30 days and they can't get into this other doctor for another 2 months or 3 months or whatever, then he will fill that one that they already have. Obviously, without being established, he can't prescribe them something, that they're not already prescribed, but 9 times out of 10, they'll be leaving there already on a medication. You're welcome. Yeah. Yes. Mullen Flats.
Yeah.
Yes. What's it called? Mullen Lotus? Okay, yeah. They had their grand opening today at 11. Yeah. So I'm gonna work on collaborating with them as well. I had a girl in class today who broke down and who's afraid to get out because she has a mental illness, and she had a stroke as well while she was incarcerated, and she's really struggling, and she has no one. And when I told her, I said, you're not alone anymore, we're right here. She just started bawling. And I told her about this new place that opened today, and, potentially that could be somewhere she could go, and they will help her transition into living on her own and stuff.
Yeah.
She's not the only one. I mean, there's several that we work with that are battling the same thing, and when she started crying, I walked over and gave her a hug, and I said, it's going to be all right. And she goes, it's the first time anyone said that they're going to be there for me.
Wow. Yeah. You're all doing amazing things.
Thank you.
All right. And then vital statistics, Loretta.
Hello.
Overdose is still busy. Last 3 months, we did see quite a few bursts going out to Mental Health America and DCS. I'm assuming with the mental health, it was probably because the cold weather was coming in and they needed to get into shelter. You would see that our report might have looked a little different. We are gonna go a little different in the new year coming forward. We're gonna try to give you guys more statistics. So on the report coming up, you might see a little more, a little less. But if you guys would like to see anything different on the report, all you have to do is give us a call or an email, and we will get you guys what you need. Is there any questions or anything? Go ahead.
Can you clarify, you said birth certificates going out to Mental Health America, is that birth certificates? So people are
They need-
living in some of their facilities
Yes.
and having a
Like-
baby, and that's where they, okay. and
Like, the homeless.
Or DCS's custody. Mm-hmm.
And DCS, the children are in their custody, they have to have their birth certificates.
Okay.
And then the Mental Health America, we had quite a few that's not even in Terre Haute. They're out in a different county or a different state that they would, call, or they would actually, mail in, and then we would help them.
So it could be an adult getting their birth certificate
Yes.
too? Okay, I'm thinking new babies, okay, that's where, clarifying.
That's DCS.
That's DCS, and then community corrections might be adults.
That is, yes, they're going into, they might need that when they're going into a program, that they would need their birth records.
And then thank you for the information on suicides and
Yes.
overdoses.
Yeah, if you would need anything like that on different ones, Ricky would help you with that. You could, all you have to do is email her or call her.
Probably what, and I know we asked before, if you can, just comparisons, because I know that's always interesting, are the overdoses going up, are they going down, are they?
Okay. Yep.
If that's possible.
Yep,
I
we can
would
get you
agree
guys
with
whatever you need. Yep. Okay, thank you.
Thank you. All right, any citizen input for tonight? Nice.
Very good. That's great.
They offer them a program where they kind of buy things for their from the state. Go at least once a month, so I go up there and walk the facility and explain to them what they don't want. You know, I have a story today. I won't share his name, but we all kind of know him some kind of a way. His family. He was on a treadmill and he saw me. He was, Miss Robin, Miss Robin. And he said, and he goes, showed me his little coins. It broke my heart. And he said, I finally got a really good job also. Oh, I'm just so happy for him. He said he's at 6 some days now.
Great.
great.
That's
He
awesome.
said it's the longest he's ever. That means he's good. Yes, he is self-care. I try to explain to him that is, keeps the devil out of their playground. Staying in.
All the health connections
Oh, yeah.
to sobriety, so yes, and long-term.
I really love it.
That's great. And I think you're combating substance use, but you're also combating loneliness, which is an epidemic that our whole, our public service campaigns in London for it, because it's such a big issue, and I think it's an issue in our community too, so I
Some of the questions
appreciate
that Molly told you the things that they need. When I did the recovery, class online, I think on the class, those were the questions. They asked, what do people need when they come out of jail? And all of it that Molly mentioned is what we all shared. Different programs, and they gave us a list that we could share with.
That's awesome.
Yeah.
Great. All right, anything else before we wrap up for the good of the cause? All right. We need a motion to end the meeting? All right.
Second?
All those in favor?
Aye.
All right, I'll see you all we will see you on April 16th.